Hi everyone, welcome to Planet Health episode 7. We're lucky to be here with Brad Parkinson, who's going to share his expertise in GORD or reflux. And welcome Brad, how are you today?
Good, Shannon. Thanks for hosting this one, and looking forward to talking about gastro-esophageal reflux disease.
Excellent. So let's jump in there. So anyone suffering from reflux, can you explain to everyone roughly what is it and what's going on?
Okay, so quite often called GORD or GERD, depending where you're from. Over here we call it GORD. It's gastro-esophageal reflux disease. It's a condition which develops when the reflux of the stomach contents comes up, basically, and you get that burning sensation, and it can come up to the esophagus, I should say, and that can cause some complications, most notably Barrett's esophagus, which it can alter the cells and potentially cause cancer. So that's one of the complications that is looked out for, and we've got to rule out when we're looking at this particular disease. Recent research has estimated that there's a prevalence of 10 to 20% in Western countries. So it's quite high, really, when you compare that to other illnesses. So it's a very common condition, yeah, look, it's something that I'm sure you encounter often in practice. I do with many of my patients. Even if I'm treating other things, they quite often are accompanied with GORD, especially autoimmune patients or celiac patients in particular as well. Mm-hmm. People who have issues with gluten. We don't know the exact mechanisms what role gluten plays, but it tends to be problematic for these patients.
And I could even say I've experienced it myself, probably in a big Christmas lunch or in excess and eating something and belch away. Mm-hmm. But yeah, so many people are suffering from it and would reach for quickies or something along the lines from the chemist. Yes. So let's go into, Brad, can you share what are the main causes of GORD? What are the mechanisms? What's really going on in there to make the acid and food come on?
Yep. So most people, when they come across this condition, whether they're dealing with it themselves or have heard of it, the view is that there's too much stomach acid, and that's really when we talk a bit about conventional medications and so forth. That's what's really focused on, is reducing stomach acid, because too much is being produced. But really, that's been flipped on its head, that whole view, and we have a better understanding now with a lot more literature coming out. And what we understand is that the main culprit, because for those who don't know the anatomy of the stomach, food goes down the esophagus and then enters the stomach, and there's meant to be a sphincter that prevents the stomach acid coming up. So that should allow for contents to come into the gut, into the stomach, and we should be digesting those contents, and then that comes through the pylorus, at the other end of the stomach, where there's another sphincter, and then that goes into our intestines. That's how it should work. However, what commonly happens is the lower esophageal sphincter, this sphincter at the top of the stomach, at the base of the esophagus, becomes laxed. It doesn't close properly, and that becomes a problem. And it's most commonly found with sufferers of GORD, and that's really one of our target areas, especially from a naturopathic point of view, when we treat this condition. So that's one main mechanism, and generally the one we really have to look into. But there's others as well to consider too. So peristalsis, which what that is the movement through the muscles. We quite often talk about peristalsis when we talk about the intestines, and then that moves all our contents in the bowel through and out the rectum, and the way it goes. But peristalsis occurs right throughout the body in different areas, including the esophagus too. So poor esophageal acid clearance has also been indicated too. And in people with GORD, these sufferers have poor peristalsis of the esophagus. Sorry. I've got Mr. Snuffleupagus in my head as well too. So I'm battling my childhood influences here. Yeah, so the esophagus has poor peristalsis, and this is also occurs when there's inflammation in this area too. The inflammation reduces the peristalsis as well. So not only are they getting that the contents coming up to the esophagus, they struggle to clear it as well, and then it's a bit of a vicious cycle because it becomes inflamed, and then that limits the ability for the people to clear that contents as well. Saliva flow can be affected in these areas as well, and it's quite often very poor in GORD patients, and that contributes again to further inflammation and poor peristalsis of these substances as well. And another thing that contributes to the whole picture too is the slowing of the gastric or slow gastric emptying. So that means that whatever's going in the stomach, instead of moving through like I was explaining before, it's taking its time, and it's quite often left there, build up. And this is problematic when we talk more about stopping acid with medications, because we're increasing that time in the or increasing that time of the emptying of the stomach, because the reduced acid release from this the parietal cells, so they're the cells that release the stomach acid. When that's blocked or medications block that, then we have an inability to break down our food. So we've got a slower emptying of the contents of the stomach as well. So this becomes problematic too, and then that contributes to the reflux response as well. So pregnancy will increase reflux as well. So will hiatus hernia as well. That really covers most of the mechanisms involved. Stress, of course, and then there's studies that show that oxidative stress is a big component here too. So again, when we see inflammation, we tend to see oxidative stress as well, and it becomes a vicious cycle and makes things worse.
Yeah, and as you pointed out, so many different multifactorial things, and multiple at the same time as well.
That's right, and this is the thing. Just treating one thing is, we talk about this a lot in naturopathic practice, is never going to really resolve problems. They're always multifactorial, and you've got to address numerous things, and usually multiple mechanisms as well.
So, Brad, let's go on to point number 3. There are people watching this and they're getting pain and they're getting reflux every night, and it's really debilitating. And they want to know, well, what can I do now to take action? What can I do to jump right in? And what can I do? Help me, Brad.
Okay, Shannon. Well, look, conventional medicine will use things like antacids, protein pump inhibitors, histamine type 2 antagonists as well, and these are all aimed at trying to reduce that acid. Looking at that old theory of too much stomach acid, which of course we know that there's a lot more going on than just that, and that that's not going to be the answer. And these are quite often used to get a diagnosis too. So if you're coming in, reflux or GORD is suspected. Your GP might put you on any of these medications, and then if you have relief, you're then diagnosed with the condition. You have GORD. So the equivalent of that in naturopathic practice would be our demulcent herbs. So if a patient comes in and we suspect GORD, then we might put them on demulcent herbs such as slippery elm or something like that. That will put a nice coat, protect the esophagus, and then if that relieves them or they're getting relief from that, then we will often assume that that's reflux is going on there as well. If we take that approach, which is really the conventional medicine approach, not necessarily our approach. So what can be done from our point of view? Look, we try and identify any causes or irritants, foods, beverages, or substances capable of causing the reflux episodes. We really try and rule them out. So caffeinated beverages would be some of those, alcoholic beverages, chocolate, meals high in fat, and peppermint essential oils also been found to cause it. So you'll find that in things like peppermint lollies. These are all things that we'd have to be careful that our patients aren't taking too much of, and they're definitely things that can be avoided. So some of the pain or irritation that occurs with the inflammation that goes on can be caused by things like citrus juices or tomatoes. Soft drinks and spicy foods can be a big one too. So they're all things to watch out for. Quite often just consuming large meals or high fatty meals too quickly will cause it as well. So there's plenty to look out for as far as dietary or diet goes. That's what I'd be looking at. Most of all, trying to reduce it happening in the first place.
And so somebody watching this might think, what's some tips you can give me, Brad? What's things I can try straight away? Mm-hmm. And I suspect you're going to say apple cider vinegar is one.
Yep.
And that's one. Sometimes people have a funny reaction, thinking, oh, it's logical. Well, hold on. The doctor's given me an antacid and apple cider vinegar. You want me to have acid? Well, what's the logic there? So can you a little bit elaborate on that a bit more, and maybe give us some other tips?
Yeah, look, I think it goes back to what I was saying in regards to delayed gastric emptying, because if people have been on antacids and what have you, they don't have enough fire in their stomach to break down the foods, as we'd say in naturopathic medicine, and you have that delayed emptying, which can cause that reflux action. So in having something like apple cider vinegar. Now, apple cider vinegar, is a fermented food basically, and it has a marvelous. It's one of those things that have been around for decades that we've been using in practice, and it's one of those things. I remember being taught about this, and there was a bit of skepticism until actual research came out supporting it. And even some of the more hardcore science-based naturopaths that really stick to that evidence base were really come on board with it and say, hey, yep, it is actually really, really good. And we know it's sometimes used as a bit of a cure-all, apple cider vinegar, but it does seem to have multiple benefits. And as we now know, and we're knowing more and more, as we've practiced originally naturopaths always treated the gut anyway, but we know that the gut is the big player of many things, and medicines, we're having a new understanding of how they work because of their function in the gut. And I think apple cider vinegar does do wonders for our gut, and it seems to have a very good flow-on effect. So great to have a bit of apple cider vinegar. I usually say to people, just have a capful within a little bit of water or something like that, and that usually does the trick. And I love putting it on my lettuce and or my greens and whatnot whenever I can as well. And that's another thing that can be used too. Is bitters. Bitters will stimulate that. It not only stimulates the hydrochloric acid in your stomach to then break down the foods, it also increases all your digestive stimulation of all your digestive enzymes throughout the body as well. And when we often get bitters from our foods, it's usually bitter greens and so forth, we get all these other benefits that from eating those foods as well. So that's another tip to really consider. Warm foods tend to work better. So when people are having salads in winter and whatnot, they can often suffer a bit more. Smaller portions work. Gobbling your food down at a computer, which many of us do these days, you can try and be more conscious in how you're eating. Take time out. One of the things I prescribe to a lot of my patients quite often is to eat smaller portions. Eat less and eat better. So rather than taking the standard big size or trying to gulp it down at your computer or whatever, have half as much, be conscious of how you eat, chew. That's a very important tip. Sounds very basic, but many people don't do it. And chew your foods, and you'll get a lot more nutrients from your foods that way as well, and then reduce symptoms of GORD as well. So stress in the stress throughout your day. Make sure you really focus on reducing your stress levels. If you're a smoker, that's going to be problematic as well. And at night, where it's often a problem, raise your bed head or your pillows, and give yourself a little bit of upright posture, and then that can help relieve that nighttime problematic GORD that a lot of sufferers get as well. Look, there's lots of medications that can really exacerbate it too. So, nitrates or calcium channel blockers, NSAIDs, and there's a whole list of them there that can be very problematic too. So you always, as a practitioner, we're always looking at what medications are contributing to the condition too.
Mm-hmm. Yeah, definitely. And multiple medications, and one is having an action and prescribed another one.
Mm-hmm.
Yeah. All right. That's fantastic. I think that shed a spotlight on GORD and given the viewers a little hint of what to do, hopefully get some good results with making those changes. So thanks a lot, Brad.
No worries.
So Brad, where can everyone find you?
They can look for me at bradparkinson.com.au. Or just type in Brad Parkinson Naturopath with Google and they'll find me anywhere there. Brad Parkinson Naturopath on Facebook, they'll get me there too.
Excellent. Everyone can find me, Shannon Burford, at Cura Integrative Medicine. So thanks a lot, everyone, and stay tuned for next episode. And if you've got any comments or suggestions, then post them down below under this video.
Thanks, Shannon.